Baltimore is cleaning up the debris from Monday night. There's still big questions about the distrust between the city's police department and the community it is supposed to protect and serve. Joining me now is Neil Franklin, a retired major for the Maryland State Police, former Baltimore police officer as well. Neil, thanks for being with us. This works both ways, of course. Blame on both sides. From your perspective as a law enforcement expert, how do we get to this really bad situation? And I want to talk to you about some of the reforms that have been suggested in mandatory minimum sentences and in drug diversion programs, that there's been excessive incarceration, basically disproportionately affecting the poor and particularly black men.
Yeah, I'm so glad you asked this question, because I heard you talking about, others talking about getting back to normal. And what does that mean? I mean, normal for many of the people in this city is not necessarily a good thing. If we're talking about normal, getting back to the practices of zero tolerance, you know, arresting so many people for these nonviolent drug crimes, that's not a good thing. So what does that mean? You also mentioned programs that are available, such as drug diversion programs. Seattle has what is referred to as the LEAD program, Law Enforcement Assisted Diversion. It is where law enforcement, where they come in contact with those who are using drugs and selling drugs at low levels, where they're diverted into a process of wraparound services. That's drug treatment, you know, that's health care, job training and job placement, a very successful program that's also gone to Santa Fe, and they're looking for a place here on the East Coast. That program was presented to the Baltimore Police Commissioner. It was presented to the mayor's office behind me, and no one has taken advantage of it. And the money was available to get that program up and running. Would make a huge difference in this city. You know, I left a very successful law enforcement career to manage an organization of thousands of law enforcement professionals, lead law enforcement against prohibition, to do this very thing, you know, to call issue to the war on drugs. And to end these policies of drug prohibition, to literally uncuff our police departments, our police officers who are charged with going into these communities and enforcing these laws that don't work. We all know the war on drugs doesn't work. It's a war on people. And we have to start the reform that's needed in rolling back these policies, whether it's intentional or not. The racism that's entrenched in these systems, whether it's intentional or not, we have to end it and move to a place of regulation and control for these drugs.
Well, let me ask you about Martin O'Malley. He was in the streets last night. He was a 7-year mayor of Baltimore.
Why'd you have to say that name? Well, I understand that he's coming to Baltimore. Listen to what I have to say here. In 2005, I left Baltimore City as the head of training in 2004. By then, we had started this zero tolerance, these programs here in Baltimore City under the leadership of then Mayor Martin O'Malley. In 2005, 108,000 people arrested here in Baltimore City. In 1 year, 620,000 people live in this city. Now, we're talking about multiple arrests. That's why the city got sued, because over 20% of those people who were arrested were released with no charges preferred, because there was no probable cause for the arrest. Does that sound familiar? Freddie Gray, no probable cause for the arrest? If you want, I don't want to say this, well, I'm going to say it anyway. If he's coming back to town, you may see a riot.
Well, we don't want to stir anything up here either. But I do want to ask you.
I would encourage him not to come back to Baltimore.
Well, he was there last night. He was there yesterday. We just showed some pictures of it. But I do want to ask you also about why it is taking so long to find out what happened to Freddie Gray. His spine was snapped. You know, he died in custody. Why couldn't an autopsy or some other medical result be released to the public a lot sooner than it has been?
Well, I think that they have probably completed the investigation by now. It's been a long time. They have the results of the autopsy. I'm pretty sure that they've interviewed all the witnesses that are available. There may be some other data that they have to go through. I can't be sure, not being privy to that. But now comes the decision making. Marilyn Mosby, who is the new state's attorney for the city of Baltimore, has got to make a decision. Number one, if charges are going to be placed on any of the officers that were involved here, And number two, what are those charges going to be? What do I have evidence for? First-degree murder, in my personal opinion, for what I know about the case, is not an option. That takes us to second degree and then down to manslaughter. In my opinion, as I spent a lot of time in criminal investigation with the Maryland State Police, personally, I believe that there's probably a case for involuntary manslaughter. I know those police officers didn't intend to kill anyone, but because of their negligence, which is obvious, Freddie Gray, he died.